Hello everyone, my name is Rachel Goodling, and I'm going to be presenting levothyroxine, or synthroid. Synthroid is a thyroid hormone that is man-made, and it's used to treat hypothyroidism. So we're going to take a look at the physiology of what causes hypothyroidism. Basically, the hypothalamus releases thyroid-tropic hormone, and that goes to the pituitary gland, which then releases TSH, thyroid stimulating hormone. The stimulating hormone goes to the thyroid gland, which causes it to produce T3 and T4, which are the normal thyroid hormones. And that stimulates metabolism of the body, normal growth and development, and basic functions of the body. When there's hypothyroidism, for some reason, the thyroid hormones are not being produced, and that can be a break anywhere in that pathway. TRH is not being produced, TSH is not being produced, or the thyroid hormones are not responding to those other hormones. So lower levels of hypothyroidism basically causes a slowed metabolism, which in turn causes decreased growth, lethargy, cold intolerance, constipation, and weight gain. Anything that's just a decrease in the body's function goes along with hypothyroidism. So the pharmacotherapeutics of synthroid is basically used to treat hypothyroidism, like I said on the previous slide. And the hypothyroidism can be caused by a goiter, thyroid cancer, a tumor, whether that's in the pituitary, thyroid, or could even be in the hypothalamus. And the only hypothyroidism that is not treated with synthroid is thyroiditis, which is inflammation of the thyroid, and that's because it's self-limiting and usually resolves on its own, so they don't prescribe synthroid for that. They can also use synthroid for thyrotoxicosis, which is Graves' disease, and that's actually when there's too much thyroid hormone, but they use that in combination with the antithyroid to prevent a goiter formation, which could be damaging both to the thyroid and can cause level imbalance of thyroid hormones. And synthroid is also used in IV form, which is the faster form, for myxedema coma, which is an emergency. It's when there's dangerously low levels of thyroid hormones, so basically it's hypothyroidism that is severe. And as you can see on the left side or right side there, on the bottom, those are signs of myxedema coma. So when they start getting edema on their face, it's puffy, and the hair that becomes dry and coarse, it's kind of that's a slower symptom, but the other ones, once you see that, that's an emergency, and they usually use IV form of synthroid to treat that. The pharmacokinetics of levothyroxine, it's absorbed in the GI tract, which is actually more rapid when fasting or with an empty stomach. It's distributed in the form T4, but that must be converted to T3 to have its effects, which is the same way in the body with natural T4 and T3. The T3 is the only effective form that has effects on the body and increases metabolism. So when it's in the form T4, it's 99% protein bound. But once it becomes T3, then it's not protein bound. It's metabolized in the liver, excreted in the bile. It can cross placenta and the breast milk, but it is a pregnancy category A, so it's safe during pregnancy. But when breastfeeding, you want to use caution because it can affect the baby's balance of thyroid hormones and the metabolism. But we'll talk about that a little bit later. There's two forms. There's the PO form and the IV form, which is the injection. The PO form is what people go home on if they have a prescription for this. It takes 1 to 3 weeks to see effects, and that's because the half-life is 6 to 7 days. So when we get into patient teaching, we'll see that we need to teach patients that effect won't occur right away. With the IV form, that's a little bit faster. It takes 6 to 8 hours to see the effects, and then 24 to 48 hours to see the peak effects. They use that for the mixed edema coma, and as you can see, it's not very immediate, but it is much quicker than the PO form. The pharmacodynamics of synthroid is the increased metabolism, which is anything that is an increase in the body. Anything you really associate with like adrenaline or sympathetic nervous system, that's going to happen with synthroid. So they're going to have increased oxygen consumption, increased respirations, heart rate, increased growth and maturation, and then the big one is increased speed of fat, protein, and carbohydrate metabolism. Because the problem people have with hypothyroidism is they're not metabolizing fats and carbs and proteins, which then collects fat. But you do, again, we'll later talk about how people can abuse this drug for weight loss. Some contraindications are if they have a hypersensitivity or allergy to synthroid, thyrotoxicosis, which is Graves' disease, but because that's when there's hyperthyroidism. But if there's not already a goiter, they might prescribe those together. But generally, they're not going to give that for thyrotoxicosis. Don't want to give this for an acute MI because of the increased heart rate and oxygen demands that it causes. It can worsen the symptoms of the acute MI and cause arrhythmias, so you don't want to give that to those types of patients. Don't give it to uncorrected adrenal insufficiency, which is Addison's disease, where they don't have enough cortisol for the body. It can cause adrenal crisis because cortisol is used in the sympathetic stimulation, which is basically synthroid. It kind of has the same action where it increases the body and its actions with the heart rate and breathing. So don't give it with adrenal insufficiency. You want to have caution with a few different types of patients, those with coronary artery disease because it can cause their angina to worsen. You want to start that with a low dose. And like I said earlier, caution in breastfeeding because it can alter the baby's hormone balance. And then also caution with diabetics because it'll cause an increased insulin need because it's causing more sugar in the body to be broken down for use. So they might need to watch for hypoglycemia. The adverse effects of levothyroxine are hypertension, tachycardia, arrhythmias, anxiety, headache, nervousness, GI irritation like diarrhea, and then sweating, heat intolerance, and long-term use, which is mostly what synthroid is used for. It can decrease the bone density, so there is a risk of osteoporosis. The drug interactions, it blocks the action of beta blockers. So if you already have a cardiac patient, which you're going to be closely monitoring because of synthroid's effects on the heart, if they're taking a beta blocker, then you want to doubly watch them because it's going to block that therapeutic effect for them. It decreases digoxin levels, it's also a medication for the heart, so be very careful. With statins may increase or decrease the effects of synthroid, so monitor the TSH levels, which will tell you the thyroid hormone levels and how that's all balanced out. Synthroid increases the effect of warfarin, so we want to monitor the PT and INR, make sure that's staying in a therapeutic range. So that's having therapeutic effects. Iron salts decrease the absorption of thyroid hormone, so give those 12 hours apart so they don't interact. And then theophylline clearance is affected by a hypo or hyperthyroid state. It can either go both ways, so just want to monitor the TSH to see what kind of dose you want to give for the theophylline. With patient care, you want to first do a baseline physical assessment. Get their muscle tone, weight, temperature, blood pressure, pulse, and respiration so you can compare those after they start having medication and the effects. We'll monitor thyroid function tests right away, and then you want to do it periodically throughout their course of taking this medication, which is usually lifelong. You want to get an EKG or ECG to monitor the heart and check how that function is going. Again, monitor cardiac patients for increased angina with the increased heart rate and cardiac arrhythmias. Monitor patients taking the beta blockers and digitalis or digoxin, because both of those are blocked or decreased by the synthroid. Look to see if the heart function is improving or not improving and what you can do about that. Monitor children for growth and development. Make sure that's normal and the dosing doesn't need to be changed if they're taking this. And then one important thing is hold the pulse if it's greater than 100, or hold the medication if the pulse is greater than 100, because you don't want to increase their heart workload. More patient teaching. The clinical effects may take 1 to 3 weeks, and that's the PO form, which they're going to be going home on. Like I said earlier, you just want to let them know that if they don't start seeing improvements within the first couple of days, that's not really an issue, because it does take 1 to 3 weeks, and they need to be patient and keep on taking it. Take a single dose before breakfast, because you want to take it on an empty stomach where the absorption is the best. Avoid grapefruit juice because it is metabolized in the liver and the P450 system affects that. Don't change the brand of a drug without consulting the healthcare provider or doctor, because they do have differences in how they affect the body, and it's important to make sure you have an appropriate therapeutic dose for that patient, and when you go and change it, then they might not have therapeutic levels anymore, so it's important to stay with the same brand. It is lifelong most times that people will be taking this, and then this is actually a black box warning. It's not for weight loss or obesity. It's not that kind of drug, so don't take it for that. More patient teaching. You want to have them report any weight changes, nervousness, skin changes, lethargy, sleeplessness, constipation. Any of those can be signs that the dose either needs to be increased or decreased based on whether they're showing signs of hypothyroidism or hyperthyroidism. So constipation would be something that would be seen in hypothyroidism, but sleeplessness would be something that would be seen in hyperthyroidism. You just want to look at the body and see if it's being stimulated or if it's not being stimulated enough, and that's how you can tell. Teach them to avoid OTC drugs or over-the-counter, because there's a lot of interactions. I only mentioned a few. You want to keep it out of reach of children. Obviously, it's dangerous if they get it. Contact the healthcare provider if signs of hyperthyroidism occur, which means they're getting too much of the dose. So those signs would be headache, nervousness, chest pain, palpitations, increased heart rate, diarrhea, diaphoresis, heat intolerance, and then there's some more down there in the picture on the right, which shows more hyperthyroidism signs. And then also have women do a bone density test to see if their bones are having osteoporosis, because it does decrease bone density. Okay, time for some questions. So a patient is being discharged with a prescription for levothyroxine and asked when the medication should be taken. The nurse's best response is... Boom, you got it. Take in the morning before breakfast. Question number 2. The nurse is teaching a student about the signs and symptoms of hyperthyroidism as an adverse effect of levothyroxine. The nurse should include what in her teaching? Correct. Heat intolerance. Last question. Which statement is true regarding the pharmacokinetics of levothyroxine? yes, it must be converted in the body to T3 to be therapeutic or have any effect for the body. Alright, thank you for listening to my presentation. Here's my bibliography, and have a great day.